When is urodynamics recommended for bladder pain? Have you ever wondered when urodynamics is the right choice for bladder pain? Urodynamics is a set of specialized tests that help doctors understand how well the bladder, urethra, and sphincters work together to store and releases urine. This testing measures bladder pressure, urine flow, and muscle activity to find any issues with bladder function. Urodynamics is recommended when the cause of bladder pain is not clear after initial evaluations. If a patient has persistent bladder pain along with symptoms like urgency, frequency, or painful urination, and standard tests such as urinalysis or imaging do not show any infections or obvious problems, urodynamics may be the next step. This testing is also useful for distinguishing between conditions like interstitial cystitis or bladder pain syndrome and other bladder dysfunctions. Urodynamics can assess how well the bladder can hold urine, its compliance, and any involuntary contractions that may occur. If there is a suspicion of bladder outlet obstruction or a neurogenic bladder causing pain or urinary symptoms, urodynamics can help evaluate how well the bladder muscles contract and how the sphincter relaxes. This information is crucial for understanding the underlying issues. Before considering any invasive treatments or surgery for bladder pain and dysfunction, urodynamics provides valuable data that can guide the management plan. It is particularly important for patients with complex bladder conditions, such as those with a history of bladder cancer treatments or chronic inflammation. In these cases, urodynamics can help assess bladder function and inform therapy options. It is important to remember that urodynamics is an invasive procedure that involves catheterization and may cause some discomfort. Therefore, it is typically reserved for situations where the benefits of the test outweigh the risks. The results should be interpreted by specialists who are experienced in bladder health to ensure accurate diagnosis and treatment planning. In summary, urodynamics is a key tool for evaluating bladder function, especially when bladder pain is part of a broader set of symptoms. However, it is not routinely used just for pain without other urinary symptoms or findings. If you are experiencing bladder pain, it is best to consult with a healthcare professional specializing in urology. They can help determine whether urodynamics is appropriate for your specific situation, ensuring that the testing is safe and beneficial for your diagnosis and management.